Hey, it's Evan from Warstone Prosthetics, and about 2 weeks ago I had my first session of medical tattooing after ALT phalloplasty. Whenever I've mentioned wanting to get medical tattooing after my lower surgery, people have had a lot of different questions, but the main one is, what even is that? Because it's not something that's talked about a lot, and I especially haven't seen many people from the UK speak about it. So, medical tattooing is also known as paramedical micropigmentation. It involves implanting pigment into the skin to replicate natural anatomy or conceal scarring. And it's sometimes, but not always, used after mastectomy or phalloplasty to enhance the aesthetic outcomes and basically improve the colouring in that area. Some people might get medical tattooing to cover up a scar or to create or improve the appearance of their nipples after top surgery, but there are many, many other examples as well, and it's not just something that's used in relation to trans procedures. For me personally, I had it to improve the colour and appearance after phalloplasty, where I had the skin taken from my thigh and used, and then obviously everything was just the same colour as my thigh, which was pretty pale. And obviously as well, my thigh is all one consistent colour, which wasn't what I was looking for. I had also had a smaller surgery called glandoplasty, which is to basically create the head, and medical tattooing just enhanced this surgery as well. I personally did not get urethral lengthening, and medical tattooing also helped to create the appearance of the urethra. I have the option as well in my next session to get some veins tattooed on. I'm not sure if I will go for that, but if I do, I want them very subtle because that's just my personal preference. Not everyone has to or does get medical tattooing done after phalloplasty. From what I've seen, most people either don't or do and just don't speak about it because that's probably right at the end of their transition and maybe they're just done sharing about it online. And when I say it's to improve or enhance results, I obviously mean based on what I personally want for my body. It's just to make me happier with the surgery outcome, so that's the improvement, not saying it's better than anyone else's. Hopefully that would already be obvious, but just pointing that out just in case it's not. But I hope this was a good video to just briefly explain what medical tattooing is. I will make a longer YouTube video about my experience actually getting it done and with the healing process and answering any questions, so if you have any, leave them below. I'm going to try and be more active on social media again now. If you've recently placed an order of a packer, I sent a load out last week on Wednesday, and then today on Tuesday I'm about to send a load more out. Feel free to comment or DM me as well if you have any questions about my packers that I sell or about phalloplasty. And yeah, thanks for watching.